Good afternoon, everyone. Thank you for your taking the time to join us for this ventilation and indoor air in the home webinar. My name is Tu Bui, and I am the lead in the indoor air and ventilation team. We are a team that provides technical assistance on indoor air quality and ventilation to many businesses, such as schools, childcare, faith-based organizations, community-based organizations, and other small businesses to help reduce and prevent COVID transmission in the workplace. I normally work in the, my home program is in the food program to do inspections on food safety and provide safety guidance, but helping out in this COVID-19 recovery program. At this time, I would like to introduce you to my three colleagues who also do technical assistance in this program, but I will let them introduce themselves, and we'll start with Jenna.
Hi, I'm Jenna Trong. I use she, her pronouns, and I'm currently the program project manager for the team. But I initially started out as a health and environmental investigator doing site assessments like my other colleagues. And I'll pass it on to Rhoda.
Hello everyone, my name is Rhoda Mohammed. I'm health and environmental investigator at Public Health Seattle, King County. I will pass to Daniel.
Hello everyone, my name is Daniel Huang. I'm also a health and environmental investigator at King County Public Health. We can get this started now.
Thank you, Jenna, Rhoda, and Daniel. Please note that we are recording this webinar and we'll send out the link when the video is ready to be sent out. We're hoping we're able to do it within 1 week, so we'll send that out when it's available. And also, please feel free to enter your questions in the chat box. Jenna and I will monitor the chat box, and then we'll do our answering questions at the end of the presentation. So at this time, we'll start. So today's agenda will go through, do a little overview and objectives of this webinar. We'll give you some information, a little background information about indoor air quality, a little overview about it and the health impacts of it. We'll talk about some ventilation and filtration work and how can we improve our indoor air quality. And then hopefully we're going to give you some resources regarding indoor air quality. And then at the end, we'll do our questions and answers. So today's objectives is we want to be able to help you to increase awareness of the importance of healthy indoor air, and then be able to understand the different types of ventilation and how they affect the airflow in your home. And with that understanding, hopefully that you can use it to improve the air quality in your home. So I will hand it off to Rhoda.
Indoor air quality is important because the average person spends this 87% of their time indoors. If you look at this circle, the green part is the time we spend outdoor, and the blue part is the time we spend indoor. So as we spend more time inside, we become more vulnerable to contaminants within the air, including COVID-19 and other respiratory diseases. So improving indoor air can help us to reduce airborne transmission diseases like COVID-19 and other viruses. Second slide, please. So being inside more may increase your chances of being exposed to viruses like COVID-19 and flu. So there is some sources of chemical exposure in our home that can come from indoor, drinking water, furniture, flooring, water pad insulation. So while our homes provide us a protection from weather and comfortable spaces to sleep, eat, and grow, they are also the primary places where we receive exposure to a number of different chemicals. For example, research studies conducted and house dust, such as there could be more than 5,000 different chemicals present in one sample. So as a result, people, and particularly children, receive exposures to mixtures of chemicals in the house, and it's still unclear how these exposures in the home affect our health. Next slide, please. So indoor air can be more polluted than the air outside. Because being inside, we experience more chances of being exposed to COVID-19 and other viruses like flu. So when we think air pollution, it's important to think about our indoor air. So some materials that can pollute our air may include like paint, flooring, isolation, like cooking, the activities we do, cooking, cleaning. So when you cook, if you are frying or frying with oil or using gas stoves, that also impacts your indoor air quality. So when you are cooking, it's good to use the kitchen hood and also open the window and doors if the weather allows. So all the fresh air that is coming from outside will dilute any polluted air inside. So also using HEPA filter vacuums will help you to clean your indoor air, because dusting and vacuuming also creates dust particles that we can inhale. So when you use vacuum with HEPA filter, it will filter all the dust particles that are not healthy to inhale. So when you are also cleaning, it's important to use a product that has less chemicals, because all this furniture and the materials that built in our houses and other materials that we can use in our home, they all release fumes and chemicals that can change our indoor air quality. Next slide, please. Environmental racism. So opening a window is not an option for communities next to major roads or industrial activities, because their outside air is already polluted. So it's hard for them to open the window or door to dilute any indoor air pollution in their spaces. So the only thing they can do is using box fan filters or using HEPA air cleaners to clean their indoor air. Next slide, please. So there's a lot of health impacts that associated with indoor air quality. Why indoor air quality matters to your health? Because better indoor air quality equals better health. Can you move to the other? Clean air inside in your home is important for your health, and poor air quality can lead to short and long-term outcomes. For example, next slide, please. The immediate impact of poor indoor air can be irritation of your eye, nose, and throat, headaches, dizziness, fatigue, airborne germs such as cold, flu, and COVID-19. Long-term impact of poor indoor air quality are respiratory diseases like asthma and COPD, heart disease, cancer, And also it can make any existing health conditions worse. Next slide, please. Who is most sensitive to poor indoor air? Young children are more sensitive because they are young and their body is developing. So at the same concentrations of air pollution can result in higher exposures to young children because their body is growing and it's developing, and it can damage to their respiratory and neurological systems in a greater than adults. Also, pregnant woman, because she's carrying a baby, anything she inhales, it will also affect the baby. People with respiratory disease or illness, heart disease or chronic diseases, people who are 65 years old or older, people who have had COVID-19, people who are experiencing the effect of environmental racism, and in some cases, the way person reacts to polluted air depends on individual sensitivity level, and it is different from person to person. How COVID-19 spreads. Viral particles spread when an affected person coughs, talks, or breathes out of droplets and very small particles that contain virus. These droplets and particles can be inhaled by other people. You can see the picture when you sneeze, you can produce that much particles. So when the person who has infected with the virus sneezes, that viral particles, another healthy person might inhale it, and in some circumstances, they may contaminate surfaces that other people can touch. So viral particles in the air, think like if you are in a space with other people, think of every person is a potential source of the virus. Particles come out of our mouth and noses and circulate as a droplets or particles in the air. So we are trying to prevent particles from being in the air by wearing masks or diluting the particles in the air by opening windows and doors, and also filter to remove particles from the air. So if you have air cleaner, you can use that to filter your indoor air, or bogus fan filter. And if you have HVAC system, it's also better, and you can also filter your indoor air. Next slide, please. Prevent germs from spreading. So like masks, if you are wearing mask can contain 20 to 60% of droplets coming from your mouth or nose. And if you are gathering in a one space, it's better to open the windows and doors and go outside so you can flush out the space and fresh air can come in. Also, if you have a HEPA air cleaner, you can turn on that, or if you have bogus fan filter, you can also use the bogus fan filter. Practice good hygiene and wash your hands at least 20 seconds with soap and warm water, and properly sneeze and cough in your elbow. Next slide, please. And now Daniel will talk about ventilation and filtration.
Hello, everyone. So next slide, please. We're going to start off with two terms, ventilation, which is bringing in fresh air from outside, and filtration, which is capturing and removing particles from the air. And by particles, I mean by allergens, pollens, and dust. Next slide, please. So this is natural ventilation, and a good way to explain this is in this image, you can see there's poor ventilation and good ventilation. In this image, you can see that the windows and the good ventilations are open. This helps increase the outdoor air bring inside to your indoor facility, which helps dilute your building. So if weather permits safely, like today, how it's beautiful and sunny, you can open your windows safely. And an example where you don't want to open your windows is fire smoke season, because the air is actually not great during that time. Also, if you were to use fans, place fans to blow out potential contaminated air outside and while you're trying to pull air inside through other doors and windows, as illustrated in the image. Next slide. I think Rhoda got this one right here.
Yeah, on airborne transmission, like for example, if this person has some virus or airborne infection disease, and it's the person is not wearing mask, so anything that's coming from his mouth or his nose is going into the air. So the big ones will land on the ground, but the small ones will be suspended in the air. So the other person also is not wearing mask. So that person has more chance to get infected. But the person who's far away that has less chance, even though he has also chance, but has less chance than this one. So that person will have less chance to get infected than this person. Next slide, please. So it's still the same picture, but this time you open the window and fresh air is coming in and the polluted air is going out. So this person would have less chance and the droplets in the air will be less because they are diluted with fresh air. But here the concentration is very high, so this person has more chance to get infected. So it's always important to open windows and doors as much as you can when the weather allows you to do so. So you can dilute any pollutant or virus particles in your air and you will have less chance to get sick. Next slide, Daniel.
So we're going to talk about mechanical ventilation. One good example is local exhaust systems. Inside your bathrooms or kitchen, there are fans which should be running when you're at home. This helps pull air out from the building and pulls in new air. Next slide, please. And this is how it works. You can see that the fresh air comes inside to this air purifier, exchange to your HVAC system, and it helps bring in fresh air from outside. And at the same time, when you're cooking or showering, it helps take out the air and steam and moisture, pushing it out to the outtake. Next slide. So if you have an HVAC system, it is the most reliable way to move air in your building. An HVAC system is comprised of one or more air handling units that pull air in from the outside and circulate the air through the building. Next slide, please. Outside air intake is important for diluting inside air. The reason why is that with inside air, it needs to be diluted from outside as continuously you would like to ventilate, circulate it by removing particles in the air. You would like to maintain the system by cleaning and replacing the filters and make sure they are properly seated. And next slide, please. So inside your homes and buildings, there's going to be a supply and a return air duct. Usually to the left, that is a supply air duct. And what it does, it helps allow outside air into your spaces, like your rooms, kitchens. It just allows outside fresh air to come inside your building. And the return air duct, it pulls the air outside from your indoor spaces. Slide, please. So where do you want to start? Are your supply diffusers blocked? And you can check this through the adjustable damper. And if you like to test, I think, wait, and then the next slide, I mean, not next slide. And then are your return air grills dirty? Next slide, please. And you can test out by the air movement. So usually the supply is going to be pushing the air out, but if it's a return, it's going to be sucking it in. Next slide, please. Okay, so here are some easy modifications to increase the dilution in your home. Can you open your window? Be careful about where the air currents that you may create, and temperature and air qualities are considerations. By temperature and air quality, we're talking about the humidity in your house. So, when you take a shower, we have our fans going because the moisture is being built up with the steam. So it helps with the ventilation that way. Air quality considerations is just outdoor air quality. So if it's an example like today, which is great, then you can open your windows. Next slide, please. Okay, so increasing dilution. Can you remove demand and control setting on your HVAC system? Can you increase the airflow into your wall unit? All you have to do is adjust the outside damper and the internal fan to draw in more outside air. Slide, please. And this is also another method. Consider adding a portable HEPA filtration unit. This can be sized to your room and placed near your breathing zone. What this unit does is that it helps filter out your air inside and has the ability to capture particles as small as COVID-19. Next slide, please. As I was mentioning before in the last slide, portable filter is going to have a pre-filter, a carbon filter, and the true HEPA filter. The true HEPA filter is going to be capturing the COVID-19 particles, and the other filters will be capturing particles larger than the COVID-19, which is generally a good sign. Slide, please. All right. Where would you like to place this? So a good general idea to place is, where do people spend most of their time in your home? Where would it help you out the most? These would be common areas. If there's an area that you cannot open windows or doors, that would be a great place. For example, like a basement. Generally, basements have horrible ventilation, but if you know that many of your family members or any individuals don't go to the basement, then it's okay. You can just place that unit in a living room, that'd be fine because everyone goes to the living room. Are there spaces that you cannot turn your exhaust fans? Are there any outlets and powers? You would like to take note of that because that would change the dimension of your room. And then what I mean by that is that placement. Is there enough space to keep at least 12 inches away from the wall and other electronics? And can you put it safely around children? Next slide, please. I think I'm going to hand this off to Jenna.
Great. Thank you, Daniel and Rhoda. And we also know, as we talk about environmental justice issues, that potentially you may not have access or the funds to provide yourself with a HEPA unit. So this is where DIY box fan filters come in. So DIY box fan filters are one easy and affordable way to make your own air cleaner at home. You can operate the box fan filter with the clean filter, as you can see right here, and it'll help clean the room that it's in. However, depending on the size of the room, you may want to add an additional box fan filter or make sure to keep it close to wherever you are in the room. In terms of what these filters do, they actually help clean the indoor air just like a DIY or just like a HEPA filter, or also just like the HVAC systems that we're talking about. So what they can do is filter out small particles common in wildfire or wood smoke, airborne germs such as the virus like COVID-19, mold, and dust released by common household activities like walking around the house, playing in the house if you have children, vacuuming, etc. In terms of effectiveness, we know that can be a concern for many people since it is just a DIY and it doesn't look nearly as robust as some of those HEPA filters, but the Puget Sound Clean Air Agency found that these fans can actually reduce certain types of pollution by up to 90%. So this test was done during a wildfire smoke event when the windows and doors were closed, and they filtered and counted black carbon during this. So you may think of like soot when you think of wildfire smoke, and that's kind of one of the things that they were measuring here. And here you can see that this is the amount of black carbon outside during the survey. And then here is the amount inside. And then right here at this point is where they turn the fan on. And here you can see a significant decrease in the amount of black carbon indoors, lowering significantly throughout the time that it was turned on. So that is just to reassure you that these machines are very effective at what they do. So your question may be, well, when do I use this? And as I mentioned before, during wildfire smoke days are great. When the air outside is poor, for instance, if you do live in one of those environmental conditions where you're near a freeway, maybe you're near the airport, consider using them then, as well as during or after indoor activities that create concern for air quality, whether it's cleaning, cooking, if folks are sick when they're inside, if you have concerns about COVID. But there are also important reminders that we need to talk about as regards to when not to use a box fan filter. So that brings us to our little safety talk about them. In terms of safe supervision, you never want to leave these machines unattended. You also want to be mindful of small children. While HEPA units usually have fans and grates that are small enough to keep little fingers out of them, that's not always true with the box fan filter that you may find at home. You also want to ensure that you're not using it while sleeping, just so you can monitor the device and make sure it's not overheating. And you also want to make sure it's in the room that you spend the most time in so that you can monitor it, as well as watch out for any concerns that may happen. And just as a reminder, there is no data that shows that there have been any problems with these machines overheating in the past, but we do want folks to be mindful of that because there is no mechanism that will turn off the machine should they overheat, since they are quite simple box fan filters. And continuing safe operation, we don't want to use these near water. That's similar to HEPA's. We usually want to be mindful about how much moisture there is in an area, just so it doesn't start to impact the fan itself. And as I was mentioning overheating, we do want to consider turning it off every 30 minutes to allow the fan to cool for 15 minutes, just so we ensure that the motors aren't being overrun or anything like that, since adding a filter to the back of them can affect how the suction works. And as we're being mindful of positioning like the HEPA, we want to make sure it's towards the middle of the room, away from walls, so that it can actually provide airflow. And we want to avoid angling it at dusty areas, just so that we're not resuspending those particles that have already fallen from the air. And in terms of maintenance, that's also a part of safety. So you want to make sure to replace the filters every 3 months or when dirty. So you can definitely notice when they're dirty, they'll turn dark and look just nasty. The same kind of filter maintenance happens with HEPA units as well. So the picture that Daniel showed earlier had the 3 filter layers. And 2 of those actually do need to be changed regularly as well. The HEPA needs to be changed once a year, and the carbon needs to be changed about every 3 months. But on the topic of filters for the actual box fan filters, you'll just need a 20 by 20 by 1 inch filter, and that'll work with most box fan units. And in terms of what we want to be mindful of is looking to see if they have a MERV rating of 13. So that is just a rating system used to measure how efficient these filters are and what size particles they can capture. But if you're also shopping at other stores, for instance, Home Depot, they have their own ratings, which are FPR, and you want to make sure that's a level 10 or higher. And then 3M also has a different rating system called MPR, and we would want to make sure that's 1900 or higher. All right. And next, we're going to talk a bit about the actual assembly of these units. So putting the kit together, we will just need pretty much three things. This third item can vary depending on what items you already have in your home. But primarily we'll look for a box fan, that filter that we were talking about before, and then some sort of fastening device. So some folks have used bungee cords. We've seen these little clips that are very useful. I've seen folks use duct tape, whatever you're most comfortable with, whatever you have on hand or access to. And what's going to happen is that we're going to put the filter on the back of the machine, which is actually kind of counterintuitive. I always assumed that they would go on the front. But the truth is you want the filter to be on the back. You want it to have the arrow pointing towards the fan so that when it's on, the air will be pulled through the filter in the correct direction. And as you can see, these folks just fastened it with this right here, and then it was all set up and ready to go. And we also have a little video to show how this works as well. So this is from the Puget Sound Clean Air Agency, and they're going to walk through the steps as well. So you can see another version of this. And over here, we also have another instance of how to put one of these machines together. These folks are going to be using a slightly different method. You definitely don't need to drill a hole into your box fan, but this is just nice to see how another method was utilized. Great, so hopefully those were helpful in showing you how to put these items together. And we'll have those links available in case anyone needs them at the end of the slideshow. In terms of other ways to improve indoor air besides utilizing these units, simply taking your shoes off inside, we track a lot of things into our house from the outdoor world, and we want to make sure to decrease that as much as possible. Another thing is damp dusting and mop frequently. So when we talk about dusting and mopping, a lot of the times folks will go and just use a regular cloth, but we really want those things to be damp so that they're actually capturing those particles and not putting them back into the air that we're breathing. In terms of vacuums, vacuums can be very useful for getting things off the ground. I know I get all of my dog hair off the ground with my vacuum, but when we think about a lot of standard vacuums, a lot of them don't actually have HEPA filters, so they can also play a role in resuspending particles in the air. And that HEPA filter will just be one extra precaution if you can afford a vacuum with a HEPA to make sure those things aren't being put back into the air. Also, we're going to talk about not using candles and other scented products in the house. Usually, I think if I can smell it, something's probably going into the air. One of the examples that I like to use a lot is when you're peeling a mandarin orange, you automatically smell something in the air. And that's because it gives off these compounds that are, once they're exposed to the air, they go up really easily and turn into a gas. But the same thing happens with candles and scented products. We don't want to make things smell if we're trying to clean. We want to make things actually clean. And scent is not actually an indicator of whether or not something is clean. And then we also want to talk about on polluted days, we want to avoid using gas cooktops, and as well as just generally not smoking indoors. In terms of resources that the county have for you all, we're going to talk about the COVID-19 recovery program, which is us. So we can't help directly in your households. We can always give advice and host webinars like the one we are hosting now. But we can help in businesses, faith-based organizations, whatever part of the community you take part in. We have provided assistance to all of those priority sectors to ensure that our communities are safe. So what we do is increase awareness of indoor air issues and management for priority sectors in the county. We try to identify and reduce language, financial, and other resource barriers to increase indoor air quality and reduce COVID-19 transmission. And we also work to provide support to high need sectors and personnel with indoor air quality concerns in reducing COVID-19 transmission. Other resources, we're actually starting a community clean air ambassador program. So if you were enjoying the presentation that we had today, this program is actually going to be an opportunity to take a deeper dive into indoor air quality, learning how to be an educator yourself, learning how to support your community and act as an ambassador for them, and act as an advocate for indoor air quality. So if you're interested in that, you can contact Addison Houston, who actually works with us, and his email is listed there, ahouston@kingcounty.gov. And this is a great opportunity. I will probably even sit in on the trainings just because they sound like so much fun. And hopefully they're going to be working to provide some sort of certificate for folks that are able to sit in. It'll just be a couple hours and you'll just get to learn more about air. And back to 2.
Great. Thank you, Jenna, and thank you, Rhoda and Daniel. So here are some resources that that are available out there. So there's, and Jenna will put this on the chat box as well. So there's a video that talks about transmission, dealing with diseases. So just to give you a few minute information about that. And on our King County website, we do have some more information on improving indoor air. And it's actually a pretty quick review, and it gives you an overall view about how to improve indoor air with different methods. And some of these are the ones that we've talked about in this webinar. And then we have another link here. It's the ventilation and air quality for reducing transmission of COVID. And that's a guidance from Washington State Department of Health regarding indoor air. And then the other one is the it's a link from AHAMDIR. They are a third party that certifies HEPA air cleaners. And we use that website a lot from our program. And then if you're interested in building your own box fan filters, King County Public Health also has a video to show you how to do that. And so that can be put in the chat box if you're interested. And then next we have a questions and answers session. I do see there are 2 questions that have come up, so I'll read the first one. It says here, I wanted to ask, in case it's not addressed in the presentation, are landlords legally obligated to provide clean air in rental homes and apartments through air purifiers and filters, better ventilation, and updating heating and airflow in renters' homes and apartments? You're going to, so we are a non-regulatory program, so we make mostly recommendations. You probably want to consult the landlord tenant rule, and you probably have that, but you may want to consult with your legal team regarding that. But we, in terms of air purifiers and filters, require having to provide that in a home if you're a landlord. I don't believe so. I've never heard of that before. But then when you're asking me about updating heating and airflow, it is important for a home to have heat. So you're probably required to have that. So it seems like you're asking a lot of different questions. And so that's something that you may want to consult with your legal team about that. But I know that any home you would need to have some kind of a heating system. And so yeah, if you want to do that, but otherwise that's all I can tell you. I can tell you that the air purifiers and filters do help if you use it in your home. So I'm sorry that wasn't much of a answer for you.
I'll also add, in terms of seeking out legal assistance, I think most of the cities in the county have some free opportunities to seek out legal advice if you have concerns. So check out your city website as well if you need assistance in that realm.
Thank you. And then the other question someone had was, should you keep a HEPA unit away from the window? It really depends on the airflow. Do you have the windows open or do you not have the windows open? Does anybody have any other comments? Other HEIs have comments about that? It really depends. So when we do a technical assistance site visit, we look at your space on where the windows are, where the doors are, where your ventilation is. So there's that vent that we talk about, the vent that supplies air, and then there's a vent that takes the air out. And so when we look at that flow, that's a good flow. We want from one end to the other end. So that's like if you imagine water, like a water flow coming out, and then it's coming out into your space and then leaving. So that's good flow. But sometimes when it's not part of that flow and you have corners in a room where you don't have that flow, then that's the area where you probably have not very good ventilation. And so that's generally where we recommend you to place the HEPA air cleaner, is in an area where people tend to congregate, or if there is not sufficient airflow. And I guess the other question is, if you have your windows open, that's probably not where you want to place your HEPA air cleaner. I see more questions there. Let me see here. Another question has come up is there a video on box fan filters in languages other than English? I don't know. Do any of the
I haven't
other?
seen any videos. I'm looking to see. We have a lot of flyers translated on our county site. So I'm gonna look and see if I can find that for you and send it in the chat.
Yeah, and that would be a great if we don't see it, and I think that's something that we would want for King County, and so we definitely take that question back and consider having the video in other languages other than English. So that's a very good suggestion.
Hi, this is Addison. The Puget Sound Clean Air Agency's video is available in additional languages. You just have to access it through their Vimeo account. So I will try to find that and drop that into the chat. I'll also link into the chat some of the fact sheets that we have developed around the box fan filter kit for wildfire smoke that has been translated into 26 languages as well. And I'll put that all at the bottom of the chat.
Great, thank you, Addison. And that was Addison. And so if you were interested in the ambassador program, the Community Clean Air Ambassador program, he would be the person that you could contact, and that would be a way to help your community. And I'm looking at some more questions here in the chat. Another question that came up was, you mentioned bath water can be a source of poor air quality. Can you say more about that, and when and why, please? Is there a HEI that would like to respond to that?
Yeah, I'll respond. So what we mean by this is that generally bath water can be a source. A good description of this is like, let's say you don't have your vents on while you're taking a shower, and this moisture of like a hot bath, it can create mold in your restroom, and that mold can be a bad source of air quality. So it's just poor management that can happen or unaware practices. But this is why we mentioned about having your vents on when you're taking a shower or something like that. So I hope that answers your question.
Yeah, and I wanted to add to that. So when you're taking a shower or when you're cooking, you want to turn your local exhaust fan on, and that removes the moisture. And so that's one way to remove, not just for improve indoor air quality, but to remove the moisture to prevent mold from growing in your bathroom. And you can test that to see if your exhaust fan works by using like a really thin tissue or a toilet paper, and you put it up by the vent. And there's a photo that we had done on the webinar to show you that, but you just put it up by the vent and you'll see if it sucks the tissue, and that's how you know if it's working. If it doesn't do that, then you know then the motor probably is not working. So you may want to look into repairing replace the motor, or maybe the fan is just not strong enough. And that's the same thing with when you're cooking. You want to turn the fan on so that it removes the moisture and anything else that comes from cooking. And then there's another question that we have is also, which cleaning products are the biggest problems?
So this is actually our hazardous waste management program. And it's a great website. They have an amazing program going on. And as you can see here, they want you to avoid products with the words danger or poison on the label. So all products have to put this information on their label, but you have to look really close because they're really sneaky. But the best ones to look are products with these third-party verifications. So EPA has safer choice products. They're tested rigorously, but I can send this link in the chat just so you have this available as well.
And I think, Rhoda, do you have a comment that you wanted to add to that? Oh. And then Addison, so we'll move on. If you want to let me know, Rhoda, if you're available to answer, but there's also a comment in there that one of the participants tried to go onto that website. It still seems to not be able to access in other languages. So I don't know if you could respond to that, Addison.
And here's the Safer Choice website that Rhoda shared as well.
Yeah, so public health doesn't actually own the instructional video. That is a product that was produced by Puget Sound Clean Air Agency. I can provide that input back to them about some other languages, but this is not a resource that is owned by public health. So we unfortunately don't have the capacity to do the translation for it. We are looking at doing some other content around indoor air quality that will be transcribed into or translated in language, but we'll try to provide that feedback back to Puget Sound Clean Air Agency.
Any other questions or comments? Okay, well, if there are no questions, we will end early. I'd like to thank you for joining us this afternoon. It's a beautiful day and you took the time to join us at this time, so we appreciate that. And hopefully the information that we provided to you, that you can apply it to your home and help to improve the indoor air in your home. And especially if you have children that live in the home, or may have anybody that has respiratory issues. So hopefully that information can be helpful. And if you have more questions or other concerns, you can contact me at bowie@kingcounty.gov, or you can send an email to our indoor air quality inbox at iaqinfo@kingcounty.gov. And we do continue to give technical assistance to the general public, and especially with different sectors that are out there that may need extra support and resources there. But thank you very much for joining us, and we'll send out the video link when it's available. Thank you. Have a great week and weekend.